Well, hello everyone. Welcome to Gut Check Live. Why won't my diarrhea go away? My name is Paige, and I'm with Gemelli Biotech, the makers of the three-gas breath test Trio Smart and the only test for post-infectious irritable bowel syndrome, IBS-Smart. Gut Check Live is Gemelli's educational series where we bring in gut health experts from across the country to dive into important topics, share their experience, and give you practical information to help you feel better and understand your own gut health. We will also have a giveaway and two lucky winners and a $50 code for Gemelli Test, so stay tuned until the very end. And today we are joined by Dahlia and James Marin, co-founders of Married to Health and co-hosts of the Good Gut Live podcast. Dahlia is an integrative registered dietitian and certified gastrointestinal nutritionist specializing in complex gut health issues. And James is an integrative registered dietitian and environmental nutritionist specializing in microbiome and plant-based nutrition. They're here to help us dig into why persistent diarrhea can be so difficult to figure out, from IBS to SIBO to food reactions and other hidden clues that they're going to help us identify. They will also present some helpful information, and then we'll move into a Q&A. And please note that we cannot offer medical advice and that any live question that does come in should not have any of your personal information. Unfortunately, your question won't be answered if it does. We do get loads and loads of questions, so we'll try to answer as many as possible. But we don't have time to address all of them. But listen in because your questions just might get asked or answered throughout the presentation as well. So thank you for joining us tonight. And James and Dahlia, I'll turn it over to you.
Wonderful. Yes, no colonoscopy questions or images coming through, please. Okay. And I'm just kidding. Okay, let's begin. We're going
Thank you so
to
much, Paige.
share our screen. We're really excited. We're so happy to be here, everybody. My name is James Marin. I'm an integrative gut health registered dietitian.
I'm Dahlia Marin, and we are so looking forward to diving into why your diarrhea won't go away, or maybe your provider, your patient's diarrhea won't go away. And we will try to pack this hour with as much information as we possibly can to make it as meaningful for you as possible with as many tangible takeaways. Because as dietitians, yes, we support the medical nutrition therapy, but I always say we're patient advocates as well, and we're really helping our patients and those we support try to identify why won't their diarrhea go away? Why won't their symptoms go away? But in order to understand how to alleviate something, you need to understand it a little bit more deeply. So we're going to be educating first on just IBS, diarrhea, and then what some of the roots of your diarrhea or your patient's diarrhea may be as well.
Okay, so a little bit who we are. We have our own private practice, Married to Health. You can find us at Married to Health. We have a total of 8 integrated registered dietitians, all with various specialties, but a majority of the patients we see are complicated and chronic gut issues and those suffering with those gut issues. So we do a lot here. But we do believe the human gut microbiota is the nexus of all health on the planet. So your gut microbiome is an important ecosystem. It's not just a important ecosystem, we think it's the important ecosystem. So it is very special, and that's why we're going to spend some time talking about it. Very quick analogy before we get into diarrhea, which is a very fun topic. We want to just give you this analogy of your gut being this factory line. It has structure, it has employees, it's making products just like a factory line. And so we want this factory line and all the different layers, which we're going to get into in a very simple way that we like to educate our patients, has a lot of moving parts. And so over time, those moving parts can become fractured for a number of reasons. So this would just be like a factory line, the conveyor belt wearing out, employees calling out sick or taking leave or quitting. And so that's very much like your microbes kind of revolting and saying, I'm out of here, I'm leaving,
Being forced out with things
being
like antibiotics or other agents.
right. And so all of these different fractures can add up over time. And one of the results can be chronic diarrhea, which we will get into. So a lot of the etiology here, like we said, there can be a number of reasons for this going on and why that's happening. So again, genetic predisposition, environmental pollution, changes to the gut-brain axis. So there's all these problems and it can be very overwhelming. We're gonna put it into 5 points that we'll get into later to simplify this because you're like, oh my gosh, that's everything I've been in contact with and I do, and we see it all the time from our patients. That's like me, and there's like 10,000 things of why this is going on, but we'll simplify that.
So we know IBS is something that is becoming less taboo, thankfully, and more people are talking about so we can understand it more. There are statistics that say anywhere from 4% up to 15% of the world's population suffers with IBS. We know that irritable bowel syndrome disproportionately affects women, with women making up about 60 to 65% of the IBS population, and it being more prevalent in those who report early adverse childhood events, or these ACEs. So one study found that over 76% of those with IBS had at least one of those adverse childhood events. And there are various types of IBS as well. We can have IBS with constipation, with diarrhea, a mixed type where it goes back and forth, or kind of an undetermined type of IBS-U. But of course, today we're going to be focusing on one of those, and we're going to be letting you into kind of our brains and our insight when we are helping support an IBS patient. As dietitians, we're not diagnosing anybody with IBS, but we're helping patients receive a diagnosis because it can be really frustrating to be out there experiencing these various symptoms and not have a concrete answer as to why. And we're getting better at really narrowing it down. I know in the past people would say, oh, well, IBS is BS, right? It's kind of a BS diagnosis. We don't really know why, but we are really trying to delineate and differentiate why with more and more data behind it. We have the Rome Foundation who helps establish diagnostic criteria all around the world, really, but we use it here in the US to help guide our reasons why somebody would be diagnosed with IBS. And there are 34 adult DGBIs, these disorder of gut-brain interactions. There are 22 pediatric DGBIs, and we've kind of narrowed them down to these specific buckets where something's either going on in motility, visceral hypersensitivity, where those nerves that are in and all around the gut are disturbed or irritated. There could be something happening in the mucosa, the microbes themselves, or the nervous system, because we do know that central nervous system that surrounds our brain directly connects with our enteric nervous system around our gut. But that's hard to remember. So we at Married to Health, we have narrowed this down and we've called it the 5 M's of gut health. And this really helps us help our patients in a more robust way. Because when all of these habits on the left are going well and your sleep is optimal, you are in a really good bowel movement routine, you're fasting overnight at least 12 to 14 hours, you're practicing interval eating where you're allowing some time between your meals, you're not just grazing all throughout the day or in a 6 hour period at night, you're allowing 3 to 4 hours between meals for cleaning to happen. You are producing a healthy amount of neurotransmitters, you have healthy hormone production, then we know the outcomes of these 5 M's, where your microbes, motility or movement, your membranes or that connective tissue and the mucosa that sits on top, your mind and your metabolic organs, they're all working in harmony. So you have the outcomes on top. You're having great daily bowel movements that feel complete. You're not having excessive gas that's really stinky and malodorous. You're not having GI discomfort. You're producing the postbiotics and neurotransmitters and peptides that you should be producing from the gut. So when all the 5 M's are in harmony, there are great outcomes. If one or more, or all in some cases, of the 5 M's are off, we might start experiencing some of these symptoms we named down below. We know there are so many, but really the most frequent ones we hear about are bloating, excess gas, it could be diarrhea, constipation that alternates, it could be stinky gas, reflux, nausea, early satiety, where just feel full and satisfied after a few bites, food intolerances, food allergies may be part of that. But one or all of those 5 M's can be disrupted. So we really wanted to dive in. And somebody who's experiencing diarrhea, how are we differentiating what that looks like? So first, we'll kind of take it through the Rome criteria because we mentioned it, but of course they have more expanded criteria for diarrhea as well. And they kind of have categorized diarrhea in 2 different buckets. They say you can either have IBS with diarrhea or you could have functional diarrhea. And the main differentiator with them, because they both really have symptoms that have onset in the past 6 months. They've been going on consistently for the past 3 months. But really the biggest differentiator between IBS with diarrhea and functional diarrhea is going to be pain. So with IBS-D, there are so many reasons why somebody might experience IBS with diarrhea. But we do know they have a high prevalence of that liquidy, watery stool, that type 6, type 7 that we show here at the bottom. They have the type 1s and type 2s, which are very hard and dry very infrequently. So less than 25% of the time, they're having those hardened stools or very dried stools. They are having pain traditionally with IBS-D, and they are averaging at least 3 days per month in the last 3 months of some type of pain or change in stool with IBS with diarrhea. Now, with functional diarrhea, again, same timeline. So symptoms have been present in the last 6 months or so, symptomatic in the last 3 months, but no pain. And so we're going to help you tease out reasons why. But we know, regardless of the type of diarrhea you're having, red flags to always bring up ASAP with your team: unintentional weight loss, blood in your stool, always, always should be something that you bring up. You don't want to write it off as just a hemorrhoid, but get it checked out, put it on their radar. Diarrhea that wakes you up from your sleep. Onset of symptoms at 50 or older, because that is the timeline where we see most cancer, although that age is getting younger, unfortunately. And if you have any family history of any type of bowel disorder, colon cancer, bring it up to your team ASAP. But again, we will differentiate the two with underlying etiologies or underlying diagnoses. With functional diarrhea, we see a lot of the triggers being that disorder of the gut-brain interaction. So it could be stress, it could be anxiety, it could be acute prior illness. Maybe you had infectious diarrhea, you went on vacation, you ate something bad, you got some infectious diarrhea. That could progress then into the IBS-D category, but not always. For a lot of people in this category, it could be overflow diarrhea resulting from constipation, where they will have diarrhea every 3 to 4 days because their colon is trying to wash out that constipated, backed up stool, or maybe even bile acid diarrhea as part of that functional diarrhea. And then with IBS-D, it's all the other reasons. Every other diagnosis, it could be whether it's celiac disease, inflammatory bowel disease, bile acid malabsorption, some type of infection like C. diff, COVID. It could be small intestinal bacterial overgrowth, intestinal sulfide overproduction, exocrine pancreatic insufficiency, carbohydrate intolerance or malabsorption, histamine intolerance, mast cell disease. So many reasons why somebody could be diagnosed with IBS, with diarrhea. These are all the things that could be irritating the bowels to cause that symptom of diarrhea. Because again, we don't fear symptoms, we just try to understand them and try to help you all understand why they might be happening. And I know this to be important because I am somebody who has lived with IBS or had lived with IBS. My IBS, thankfully, has been in remission for the most part in the last several years. But I always say I was my very first patient. I'm the reason I got into nutrition and integrative and functional nutrition because I had my own symptoms. And I am that typical IBS patient. I am that person who had some of those adverse childhood events. I am a female. I am somebody who fits the criteria. I took a lot of antibiotics growing up. I was an 80s kid, and parents don't have time for you to be sick. So I took a lot of antibiotics. I had kind of an interesting hybrid of a standard American diet and traditional Mediterranean diet that I was raised on. So it quickly went from me being a vibrant young kid to being this overweight adolescent to being this obese teen who was then in one day simultaneously diagnosed with several different things without realizing IBS was one of those diagnoses I didn't receive at that time. But as typical we see, I was diagnosed with an autoimmune thyroid condition, which now we are understanding always involves the gut, prediabetes, high cholesterol, fatty liver, and several polycystic ovarian syndrome and several other things. And of course, when you have all those diagnoses and you're carrying all that around, you don't feel great. And it wasn't until my husband, then boyfriend, when we were dating, pointed out to me that every single time I ate, I would say that I had a stomach ache. And so it was really in college, as I started studying dietetics, that I started to really pay attention to the gut and understand there's a lot to this, and I need to understand more about it. And just like any typical person, I thought, okay, well, if my symptoms onset when I eat, it must be something I'm eating. And I said, okay, it's the almonds, it's soy, it's dairy, it's meat, it's this, until it was everything. Because we are now understanding today's symptoms are not always about today's meals. So that is such an important thing. I want to leave with all of you, especially as a dietitian, because yes, though meals may exacerbate symptoms, they're not the trigger for a lot of your different symptoms a lot of the time. They're not the root, they're not the cause. They maybe just are reflecting what's going on in your gut. But if you or your patients are fiber maxing and you're eating plants, you're like, I got my 30 plants per week. I'm eating the fermented foods the studies said to eat. I'm exercising, I'm sleeping. However, I still have chronic diarrhea. I have urgency. I have gas that smells like rotten eggs. I'm having abdominal pain, nausea, bloating, and more like I once did. It's important to understand the causes. And here on this slide, this really talks about the M of microbes. So we know there are so many different microbes that can produce different gases in our gut and in our body, and that will then cause different symptoms or produce different symptoms rather. When it comes to diarrhea, we've kind of highlighted in the pink and reds the ones that will really be involved in diarrhea oftentimes. So it could be that one has SIBO, small intestinal bacterial overgrowth, and maybe they have an overabundance of hydrogen producing bacteria. We name them there on the slide, E. coli, Klebsiella. And usually the person with SIBO, hydrogen SIBO, they're having diarrhea. They might be having weight loss, nutrient malabsorption. They're not usually really bloated. So they don't really have bloating. They're not really distended. Whereas somebody with ESO, intestinal sulfide overproduction or overgrowth, they have an overabundance of what's called sulfate reducing bacteria. And there's a wide variety of them. We've named a few there on the screen, but usually that type of hydrogen sulfide gas is very irritating to the nerves. And we actually have 5 times more nerves in and around our gut than we do in our brainstem. So there's a lot of nerves there to become irritated by this gas if it's there. There's an excess amount of this gas. So we, one, are not only going to smell it, and like I mentioned, it smells like rotten eggs, but you're going to usually experience things like stool urgency, bloating, which differentiates it, abdominal pain, and a lot of my patients with ESO will experience vasovagal episodes surrounding bowel movements or digestion, especially. So they'll say right before, during, right after a bowel movement, I get dizzy, clammy, shaky. I've had patients who have even passed out associated with a bowel movement. They are having a visceral vagus nerve reaction to their bowels moving. And again, that can happen either when you're emptying your bowels or after eating when your bowels start to move as well. And then those can progress even into things like ulcerative colitis or colon cancer as well. We're starting to identify, and now that we have more information in the microbiome, we're starting to identify that these sulfate reducing bacteria are very prevalent in IBD and colon cancer, colorectal cancers.
And so here we get into testing. So many of you have probably had testing, many of you are providing testing. And so it's understanding it's the idea of test, not guess. So it's very important to not overdo the testing and to have the right amount. So you could see too many lights versus not enough. We want it to be right in the middle.
And we know how this feels with our patients. We see both sides. We see patients who come to us frustrated, seeing, my provider did the celiac testing and they tested me for H. pylori via breath test, stool test, but that's kind of it. They don't want to test me for anything further. And then we have people on the other side who say, I spent $50K with a functional medicine provider and I have all these stool and hair and mineral analysis testing, but I don't really even understand what's going on. And it doesn't seem like that person understood either. So an integrative nutrition, integrative health, if you're being supported, you should have the right amount of testing, which is only necessary. And we always like to say, if it's not going to change the outcome of the treatments, why are you doing the test? So if your provider is just testing just to test, a little bit of a red flag. So you always want to ask, how will this change my treatment plan if I invest in this test or if I do this test? But we do know there's lots of different options, and there's a lot of good baseline tests to get. You want to get all the baseline blood tests, check your cholesterol and your metabolic panel, and check your vitamins and minerals, rule out celiac disease and inflammatory markers, test for enzymes. In stool, test for inflammation, fecal fat, bile acids. Definitely get a colonoscopy, endoscopy if it's warranted. And now we know the starting age is 45, but it can be earlier if you're symptomatic or have a family history. And then we do know there's other great ways to test at home. So there's the TrioSmart. TrioSmart is the 3-gas breath test to assess for SIBO and ESO. Most breath tests that you either receive at home or you do in office with breathalyzers, they're not testing for that ESO. So you want to get that 3-gas breath test. So we absolutely love ordering the TrioSmart test for ruling those things out. And then the other one that we absolutely love regularly ordering in our practice, or we recommend our patients request from their providers, is the IBS-Smart test. It is a blood test. You see that little device that this woman has on her arm. It's a Tasso device, and you just pop it on your arm and it collects a blood sample to test for antibodies that would indicate post-infectious IBS or post-infectious gastroenteritis. So if you are experiencing chronic diarrhea, it's so important to understand why so we can really help alleviate one or all of the 5 M's. And so we've stated here just some of the possible treatments that you could be utilizing if you are experiencing anything with your 5 M's. You do have the symptom of diarrhea. That could be antibiotics, herbs. It could be binders like bismuth. It's the active ingredient Pepto-Bismol. There is a trace mineral called molybdenum that helps to break down sulfur. You could be using antispasmodic agents like Imodium or stool bulkers. We love using low FODMAP soluble fibers like partially hydrolyzed guar gum. Other binders might be helpful as well. If it's something going on in the membranes, you might need to correct carbohydrate intolerance with enzymes, reverse damage of inflammation. You might need more protein in your diet, L-glutamine. You might need some of these gooey, what we call mucilage foods that help to rebuild that mucus that's protective. For your mind, we like to recommend gut-directed hypnotherapy. Patients are often prescribed low-dose SSRIs or anticholinergic therapy. And then for metabolic organs, things like correcting exocrine pancreatic insufficiency with enzymes, or correcting bile acid malabsorption with bile acid sequestrants, working on your liver health, your gallbladder health with the right things. But again, if you're not properly being assessed, it's hard to properly get treated.
Yes. And so this gets into our favorite part as dietitians is the diet, right? We are all about nutrition and lifestyle. And so we've seen in the standard American diet a low fiber plate. And really, fiber is the key here. Plants and fiber are the substrate, so to speak. They are the food of the microbes that we want to care for and love. And a low fiber plate does not do that. Therefore, we're lacking in short chain fatty acids, peptides, and so much more. So on the other end of the spectrum, we go, well, then I'm going to have a high fiber plate and I'm just going to eat more fiber and everything's going to be all great, happily ever after. But we see that in many of our patients and many of our patients who come to our practice go, I'm doing more fiber, I'm doing the prebiotics, the things that I'm supposed to eat, and I feel worse. What's going on? And that gets into what we just talked about in so many layers there of what can be going wrong, even though you seem on the outside like you're doing everything right. And this is where we get into another layer of this is our integrative functional medical nutrition therapy. That is our specialty as dietitians, where we go, what about a pre-digested fiber plate? This is freezing, this is roasting, this is boiling. These are maybe focusing on more soups. When we do that, for example, freezing, we are perforating all the cell walls in a fibrous plant so it's easier to assimilate and digest if your gut is maybe that fractured conveyor belt, so to speak. So when we get into a FODMAP diet, this can be really helpful because let's say high FODMAPs that you're maybe struggling with are producing more of the gases, producing more of the inflammation, which is causing even diarrhea to progress and persist. Again, FODMAPs are not bad, fiber's not bad, sulfur isn't bad, histamines aren't bad, which we'll get into, but in the right context, you may need to adjust and alter depending on what's going on. Again, we are all about getting to the root and not just going, oh, you're having diarrhea, here's a medication that's going to help with not having diarrhea. Well, why do you have diarrhea to begin with? We want to look at what you're eating and what's going on and diving deeper. So an example of a high FODMAP plate will be foods here. It's pinto beans and refried beans and some processed foods, dairy, garlic, and onions, the kind of usual suspects there. Again, garlic and onion isn't bad, but if you are needing some support in the gut microbiome, it's yeah, it's time to maybe try a low FODMAP plate, which you still can get great fiber, you still can get a diversity of plants, still can support your gut microbiome with a low FODMAP plate. Speaking on sulfur, again, we mentioned dietary sulfur containing these amino acids that can trigger some of these microbes that like to eat those sulfur containing amino acids, and therefore they are thriving, they're partying, they're maybe a little bit overabundant in areas they shouldn't be, causing that gas production, causing that diarrhea. And so some examples here. So a high sulfur plate, again, ground meat, scrambled eggs, garlic is still in there as well. Garlic and onion, man, they're just the usual suspects. But again, these aren't bad foods per se, but a lower sulfur plate can help in this medical nutrition therapy in the time being until we are figuring out all angles, looking at all aspects, and taking an integrative approach. So we do want to touch on histamines. Histamines are all the rage right now. Histamines, we're seeing that all over social media and our feed, but it is quite true. There are histamine receptors all over our body, and histamine can also trigger and be a puzzle piece in the symptoms you're experiencing, especially with diarrhea.
Or even as a result, we are seeing that a lot of patients who have gut inflammation, especially triggered by something like ESO or that intestinal sulfide overproduction, or even patients who have SIBO in general, because they get gut barrier damage, they tend to have some level, not always, but especially if they've had prolonged SIBO, they have some level of gut breakdown, histamine intolerance. Some may even have mast cell disease, but for some patients, they might need an altered histamine intake as well. And we know histamines are just this natural chemical that's in many foods, especially foods that need to be ripe to taste good. So if something's bitter or gives you kind of that cotton mouth, if it's not ripened, if something has a lot of small seeds, if it ripens very quickly and aggressively, if it's been intentionally dried, aged, or fermented, it is going to have more of that biogenic amine, which is called histamine in it. And it can bind to all those histamine receptors around, triggering any of those symptoms you saw on that previous slide.
So a high histamine plate, we want to get to
Yummy,
a
lots
lot of
of
your
fermented
questions.
things.
Yeah. A low histamine plate.
You might need that temporarily. And as you see here, this includes things that are frozen as well. So that might be part of reducing the histamine production because histamine is part of ripening. So you want to try to avoid excessive amounts of ripened food if you need a low histamine way of eating. And that's not everybody.
Mhm. And so the idea, we break it down kind of everything we went through here. And important aspect is digestive enzyme therapy. So this is where enzymes can come in and be very, very helpful with the symptoms you're experiencing.
And this can be helpful in the reintroduction phase because one, nobody should be on all of those elimination diets at the same time. And we see that some people do come to us and they have eliminated all those things. They're eating 3 to 5 foods. So some people do eliminate everything. But this can be helpful in using enzymes when you're trying to reintroduce, and so that you don't need to live on any of those elimination diets. This is basically saying, well, if you have an injury, you're not just bedridden for weeks on end until things heal. Get a boot, get some crutches, get a wheelchair, get a scooter, get what you need to get back out there and keep living your life. So that's how we think of digestive enzyme therapy. And there's various types of enzymes for various needs. So whether you are low FODMAP, low histamine, low sulfur, there are appropriate enzymes out there that can be helpful to help alleviate some of the symptoms that you might experience when eating some of those higher foods.
We have to come out and feel with each meal. So it's also how you are interacting with your food. Is it great? Is it fine? Is it strained? Is it toxic? So, some of the feel with each meal aspects is the food that you're letting in your home, as well as who you're eating the food with and how you're feeling when eating that food. Are you eating at your desk in front of your computer? Are you eating while driving? Are you eating with someone who makes you feel not so good? All of that matters in terms of your stress and nervous system support. And so, yeah, feel with each meal is chewing, is eating with friends, eating with people that make you happy and joyful, getting off these phones that we're always in front of, and so much more. Very, very important. Um, and so just a quick recap, but here in this recap, which you can read, what I do want to say is it is extremely important to not be on that elimination diet, to stay there and just think that's normal. A low FODMAP diet is temporary. A low sulfur diet is temporary. Low histamine is temporary. The goal and our goal and what we do as dietitians is to help you eat and tolerate more and more foods. We want diversity. If you're only eating 5 foods, we want to make that 50. That is the goal, and
Mhm.
that's why we use these therapies, use the testing, especially Trio Smart and more. And so we want to use this to get you to that ultimate goal,
And
which
help you
is
heal with each meal.
help you heal with each
That's
meal.
our goal. So
So we
thank
want to
you
get to questions. We try to get through
with
that
us further.
quickly.
We have many places for you to do so. We'll talk about this again at the end, but definitely connect with us. And we know you submitted some questions
Yes.
prior, so we're gonna help answer a lot of those questions. And then please, if you have any additional questions, we'll try to get to as many as we can in the chat. But that was, we talked about diarrhea. We had some diarrhea of the mouth. Hopefully it wasn't too overwhelming.
No, that was truly amazing. Thank you. That was so much information, really helpful information. Thank you so much, James and Dahlia. Really appreciate that and for putting that whole presentation together. Thank you. All right, so we're going to kick it off with a few questions that we received.
Yeah.
Let's start with okay, this was a question by quite a few people actually. Leela, Sally, Sandy, Elizabeth, Ruth. They're all wondering why can someone alternate between diarrhea and constipation, sometimes even within the same bathroom visit, and why should they start when trying to understand that pattern? Or sorry,
Yeah.
where should they start when trying to understand that pattern?
That's a great question. We do know these microbes don't live in isolation. There's usually a whole community. You can have different types of microbial overabundances, which can contribute to different types of symptoms. And I will say, a lot of the times with alternating diarrhea and constipation, that person is predominantly constipated. And the reason they go back and have subsequent bowel movements, which get looser and looser, is because, again, they're maybe having some of that overflow diarrhea associated with the constipation because they're just not fully evacuating. But if you're noticing, within one day, your stools can smell very different. The texture is very different. The consistency is very different. We need to do some investigation there with the M's. It could be bile acid malabsorption that is causing a firm stool in the morning that's nice and brown, and maybe you're having that first bowel movement's a nice type 4, and it's great. But then 30 minutes to an hour later, you're going back and it's looser and looser. And as the day goes by, it's more and more yellow. That might indicate bile acid diarrhea. It could be carbohydrate malabsorption. It could be SIBO, EMO, ESO. It could be so many different things. But those are just a few ideas. But definitely getting the right team on hand can be helpful in assessing.
Yeah, I had no idea there were so many different kinds of diarrhea with, reasonable reasons why you would have it. So that's really helpful information that it can go back and forth. Um, All right. The next question is from Trisha, and they ask, what should someone consider when chronic gut symptoms continue, even though their tests, including SIBO testing, are coming up normal?
Yeah, so we know not all chronic symptoms are from SIBO, right? And so
Mhm.
small intestinal bacterial overgrowth, and there again, like we showed, there's different types of overgrowth. That doesn't necessarily mean that's where your symptoms are coming from. This is where the 5 M's are not all about SIBO, and so it's exploring each M thoroughly with a team that you can trust and know. And so they can help identify maybe there's other root causes, other things going on, and you want to just continue to explore that. So yeah.
That makes
Think.
sense. Yeah, thank you.
Yeah.
All right. This one is from Scott. He asks, how can someone tell whether symptoms are more consistent with SIBO, a food tolerance such as lactose or fructose intolerance, or another food reaction?
So I would say test, don't guess. So you can test for SIBO, you can test for carbohydrate intolerance, and that's something that Gemelli offers as well as different carbohydrate tolerance tests. Um, and then if you those come out negative, inconclusive, you can always do a food elimination with reintroduction to see what foods specifically you're reacting to and if there's anything specifically we can nail down. But usually testing will give us a lot of information. I want to throw allergy testing into there as well because people have really not been testing for allergies anymore. And I'm seeing so many of my patients with chronic IBS come back having allergies that nobody ever tested them for. So don't rule that out. Go see an allergist if you need to and get IgE blood testing, get skin prick testing. Really try to figure out, do you have some type of food allergy or elemental allergy? You could have something like a nickel allergy. You could have a histamine intolerance, but there's ways to test for all of that. And then again, the kind of a free test is elimination with reintroduction, but you don't want to eliminate for too long, no longer than 4 to 6 weeks.
Awesome. Thank you. Yeah, we get a lot of questions about fungal overgrowth and SIFO.
Mm.
And would that be something that would be considered in an allergy test, like a standard allergy test, or would that be a different protocol?
They do test for a few types of candida on allergy tests. Usually they'll test for mold, but we do know there's a lot more than those couple types that they test for that could be out there. Really, the gold standard testing to rule out SIFO is small bowel aspirate. So it would have to be during an endoscopy where they take a little bit of that fluid from the small intestine and see if any yeast will grow on it when they culture it. So that's really the best testing we have. Organic acid testing is out there. It's not necessarily validated yet, but there is urine organic acid testing that would tell us about those metabolites or those post-production molecules from some of these fungal species. So all three could kind of give you somewhat of an idea about it.
Yeah, that's great. Thank you. All right. This next question is from Jocelyn. She asks, if a breath test shows methane predominance, but diarrhea is the main symptom, how should someone think about that apparent mismatch?
Well, we see this a lot with some of our patients who come in and go, yeah, I did the breath test, and it's kind of like, where did you do that? And this is what's special about Gemelli, where you can do three breath
Three
tests,
gas.
three gas tests. And so it's this idea where someone goes, yeah, I've done breath tests all the time. Well, you're only testing for two gases. And so with that, this is where you can be methane dominant, but then if you're not testing for the hydrogen sulfide gas, you can also have hydrogen sulfide gas. And if it's not there, you won't know that. So this is where some of that confusion and a lot of people deal in black and whites and absolutes where it's like, well, I'm methane dominant, but I have diarrhea, so I can't have diarrhea as well. It's like, no, let's give you more context and kind of just see. And that's where the Trio Smart breath test can come in and be extremely helpful. So they can see that on paper, they can see all their numbers in the right kind of full view, and then we can go from there with an action plan.
And I always like to remind people, yes, absolutely test for SIBO. And remember, SIBO is not a root cause diagnosis.
Right.
It's a symptom that you can have of that small intestinal bacterial overgrowth or intestinal methanogenic or whatever type of overgrowth in either part of your colon. But you want to always ask, how did that happen? Why?
Yeah.
Which of my 5 M's needs some TLC in order for that overgrowth to kind of balance itself back out and for me to go back into eubiosis?
Makes sense. Thank you. And for those who don't know, usually with a methane predominant test, it's usually constipation that is the correlating symptom. With SIBO, we found that it's bloating is the main symptom for SIBO or hydrogen predominant diagnosis. And then with ISO, it would be chronic severe diarrhea. Is that what you've found as well with the symptoms that match the gases? And that kind of situation of bloating is usually SIBO, hydrogen, and then methane for constipation, and hydrogen sulfide for chronic diarrhea.
Oftentimes, yes. Not all of my hydrogen SIBO patients are bloated because they're having such frequent diarrhea. So it depends on how much SIBO they have, which is also another good reason to test because you want to know how much you have of each type of SIBO or overgrowth so that you can properly address them. Because a normal amount of hydrogen is less than 20 parts per million, and somebody comes back on their test with 120, it's unlikely that one course of antibiotics or herbs or whatever they're using to treat it is going to get rid of it. So that can be so important as well because things can shift and things can alter so frequently. We have people come back with two types and then they try a treatment and maybe the rifaximin reduces their hydrogen and then their methane goes up significantly because they've removed some of that hydrogen sulfide or that hydrogen from the mix. So things can shift. So testing is always favorable so that you just have more information.
Definitely. It's so interesting. That brings us to our next question. If gas and other symptoms continue after treatment for SIBO, what should be reassessed rather than simply assuming that the treatment failed?
Yeah, reassess quantity. So, how much is left after the treatment course? You can reassess symptoms if they're exactly the same, if they've kind of shifted, because microbes may have shifted as well, and subsequent gases that they produce that trigger symptoms. So, you really want to continue to reassess those symptoms, keep a log of symptoms so that way you can see, oh, okay, I no longer have that rotten egg smell to my stool and my gas. Now I am a little bit more traditionally constipated. Now I am a little bit more bloated. So we can help track and understand where you are in your journey.
Awesome. Thank you. Deborah and Sylvia are asking, what does gut recovery look like after repeated or significant antibiotic exposure? And what can people do nutritionally to support their recovery?
I love this question. I commonly see that ESO can be a result of recurrent antibiotic exposure. I've had this happen in many, many, many of my patients who needed 3, 4 courses of antibiotics within a short period of time. And then these opportunistic microbes, these sulfate reducing bacteria, can kind of overgrow in the gut as a result. So you would think, well, let's treat them then with more antibiotics or herbs or whatever it is. But usually we like to start by re-inoculating the gut with helpers. So we might introduce the right prebiotic. We might introduce a specific probiotic if we identify that's the appropriate course of action. We might introduce a binder like bismuth or another type of binder, and then consider that next action step of antibiotics or herbs. We might consider first that low sulfur diet or low FODMAP diet to see if symptoms improve, but it can definitely be kind of re-loving and re-nourishing the microbiome before we try to hit it with more of things. I think oftentimes people assume herbs are natural, so they're always safe and they're always fine. But what most people don't realize is these herbs are broad spectrum herbs, most of them. They're heavy hitters. So if you've come off of 3, 4, 5 courses of antibiotics and you think herbs are going to be kind of a more gentle treatment, that's sometimes the opposite of the truth and sometimes can make things worse. So you want to work with somebody who's qualified, who understands what's going on, who can help guide you.
Definitely. Thank you. There's so many different avenues to try. So, yeah.
Mhm.
All right. This one is a little bit specific. Can having your gallbladder removed contribute to chronic or post-meal diarrhea?
Yes. And so gallbladder goes into the M of the metabolic organs. And so, the analogy I give is we're here in Southern California. So with the LA fires that weren't that long ago, we think it made me think of reservoirs. And so when that popped into my head, it's like, yeah, just like we want water reservoirs for the fires, we want this bile reservoir. And yes, we can produce bile just fine, but the gallbladder is there to be an immediate response to anything going on. It's also part of the immune system response. So it's there to protect you as well as help with motility and help with digestion and so much more. So, definitely having your gallbladder removed. There's also a great study that showed those with a cholecystectomy, so gallbladder removal, were about, I want to say it was, don't quote me on this though, about like 30 or 40% more likely to develop IBS over the next 3 years. So yes, and then we want to ask the question, why did you need your gallbladder removed? What
Mhm.
was causing that? Was it just a bad gallbladder? Probably not. Let's explore why the gallbladder got overwhelmed and inflamed. And if you never explore that, chances are whatever was there is still there. And so just removing the gallbladder, it is helpful, but is it the root solution? Maybe not. So,
And what people don't realize is the gallbladder is, like James mentioned, this reservoir. Every time we eat, our gallbladder empties that bile that it's carrying. It squeezes out at least 35% of the contents of the bile that it's carrying. So the liver is going to keep keeping on. It's going to keep making bile after the gallbladder is removed. But a lot of people can start experiencing diarrhea because instead of this big bile push with just meals that's very controlled, the liver's managing over 500 functions in the body. So it's like, hey, this is when I have time to give you bile. Take this bile. And it goes into your small intestine, and you can have diarrhea throughout the day because of that just constant drip of bile. So we can see constipation, post cholecystectomy or gallbladder removal. We can see diarrhea. It's very prevalent to have other GI symptoms after that's been removed. So keep all the organs you can. If you need to let it go, work with somebody to help you alter your diet and then work on your gut after that.
Amazing. Thank you. We got a lot of questions about the gallbladder, so that was very helpful explanation
It's
of
so prevalent.
function. Yeah. Okay, this one is from Eleanor, and then a few other people asked a similar question, so we kind of wrapped it up. Why can foods such as mushrooms, greens, and fructose trigger diarrhea or cramping in some people? And how do you determine what is actually causing that reaction?
So, those foods, a lot of them, like the mushrooms, the fructose, those can be higher in those fermentable carbohydrates, those FODMAPs. And if you have an overabundance of those hydrogen, methane, sulfate reducing bacteria, they will ferment those foods and they will produce the gases that can trigger diarrhea or cramping as a result. So you want to understand again, do you have ESO? Do you have hydrogen SIBO going on underneath that? Or is it perhaps a histamine intolerance if you're specifically reacting to the mushrooms and certain greens, especially greens that go really ripe very quickly? So, spinach, arugula, ones that get mushy, particularly, can be a little bit higher in histamine. So, are you having any type of histamine reaction when you're eating those foods? Histamine can be a big trigger for diarrhea. So, you want to make sure that that's not a part of it. But if you want to determine what's actually causing the reaction, again, test, not guess, eliminate, reintroduce, and if you need to, try enzymes to see if your symptoms get better with the enzymes after the root has been treated.
Awesome. Thank you. Next one is it's a whopper. Okay. So we get a
Okay.
lot of these questions every single time we do a live Q&A or any kind of Q&A. This one is sent in from Gilbert, and he asks, when SIBO or EMO keeps recurring, how should people think about antibiotics, antimicrobials, probiotics, prebiotics, diet, and the underlying factors that may be driving the reoccurrence?
Well, what I'll say
Hmm.
is emo especially can be very tricky.
Yeah,
Like emo can be quite stubborn because it's archaea. It's not actually bacteria, it's archaea, and they can be very, very
they are resilient.
stubborn and resilient, tricky. But in both SIBO and emo, you want to understand, okay, why was it there to begin with? What caused that? For many
Mhm.
women we see there's pelvic floor issues. There's many
Mhm.
issues and men as well.
Mhm.
Yeah. And so there's many other underlying issues where it's going, I didn't even think of my pelvic floor. I had a patient who was a male who had a spinal injury from a rock climbing accident, and he never got it properly addressed. The fascia from D1 athletes from college or current athletes or triathletes and so much more where they're not even thinking like, oh my gosh, this ripple effect of the body that can then cause a type of overgrowth because you're straining or your motility is not on where it should be. Your muscle and fascia is too tight to properly allow stool to move and motility to move. So
Maybe you have
many
a
things.
connective tissue disorder where there's a little bit more laxity to that tissue and it can't properly coordinate to completely evacuate your bowels. So, if you have recurrent SIBO or EMO, you really should be working with a good team to understand why. I have some of those patients. I've been with them for 5 years and we're still working on their emo, but we know they have gastroparesis that we're working on. They have a connective tissue disorder. They have, like James was saying, a pelvic floor dysfunction that we're still working on. So for some people, it can be chronic treatment where you're getting low dose treatment chronically. For some people, it's one course of treatment and it resolves and it goes away. Everybody is on this SIBO dysbiosis spectrum. So it's really identifying where you are in that spectrum and who needs to be on your team to help you with that. Do you need a pelvic floor physical therapist? Do you need somebody to do acupuncture and acupressure? Do you need a dietitian? Who do you need on your team to help support these things that we know could be a little bit more chronic? Do you have some type of neurodegenerative disease? And do you need to chronically have that support? So it's so important to understand those things so that things aren't falling by the wayside.
And so quickly, I would say before you consider the next round of treatment, consider the next person on the care team, possibly before that, and
Mhm.
expand the context of why you're doing that. Because we do see the patients who are like, I've done 4 rounds
Mhm.
of antibiotics over the course of this past year, and I'm still back where I started. So that's definitely, I mean, hopefully before that, but definitely when it's time to go, okay, what am I not seeing and who can help me see what
Mhm.
I can't?
And
So.
I will say, we do know fatty liver, or now it's MAFLD, but we do know that's on the rise. And so we're seeing that associated with emo so frequently. So if something like that is going on, definitely working on your liver health is so important. Working with your team to identify the best
Luckily, all
things.
Americans have super healthy livers. Everyone here in the US, livers are great.
That's great. I want to I've just had a lot of these questions come in on the chat right now.
Okay.
People would love to know if you are taking new patients and if you work remotely with patients. I know that perhaps we can give them some sort of contact information in the replay email that we send out, how to contact you and how to possibly be seen by you, if that is a possibility.
Totally. Yeah, so Married to Health, marriedtohealth.com. We do telehealth all over the world, all over the US, and we are in network with most PPO insurances as well
And Medicare.
in many states and
Mhm.
Medicare. So yes,
And if you can't see one of us, our team is amazing. They've been with us for years. So our team is comprised of so many wonderful dietitians who offer different things. We have a future naturopath on our team. She's a couple months away from becoming a naturopath. We have a PhD researcher. One of our dietitians is certified in neo-emotional release to really help with somatic release and that gut-brain interaction.
Mind M.
Yes, so we're so grateful for our team. But yes, we're always accepting new patients and we are only telehealth. So absolutely, we do virtual care.
Awesome. And you also utilize the Trio Smart and the IBS-Smart test, malabsorption test that Jameli makes. So, interpreting those results, you could take the test and then bring it in and you could guide, anybody on their results. So that's really awesome.
Yeah.
Great. All right. Okay, so that was many questions of that. So thank you. All right. So Beverly, Barbara, and Lori are asking if diarrhea continues despite taking a probiotic, digestive enzymes, or other gut health supplements, how do you know whether those products are actually helping or potentially making symptoms worse?
One,
Yeah.
stopping and seeing if you feel the same, better, or worse without them. Two, getting the right guidance. Of course, we always want to self-treat, but so frequently someone's like, oh, I got influenced by TikTok shop and I bought this probiotic, and maybe it's not the probiotic for them. Maybe they have a histamine intolerance and these are histamine increasing strains, and that's just not the right strain for them. Maybe they have emo and they shouldn't be taking that probiotic at all. Maybe they don't need a digestive enzyme, but they need another type of support. So really, one, stopping them, seeing if things get better, restarting them, seeing if they actually are helping, and then three, working with a qualified professional who can help provide guidance on all of these nutraceuticals that are out there. We do know in the US, the nutraceutical industry is approaching $1 trillion industry. It's unregulated, and so anybody can make a supplement. But some are great, not all
Just as
for
an
people.
example, last year, parasite cleanse. And so we've seen lots of people going to urgent care, coming into our practice. They've been on a parasite cleanse, had no idea what it does really, what they're taking, and now they're suffering with the aftermath of that. And so
Mhm.
you have a parasitome, you have commensal parasites in your body that actually give you benefits. And so you don't want to kill all of them.
Unless you need to, unless there's a
Unless
true parasite over that's been diagnosed.
which someone can help guide you with, and then the
Mhm.
right parasite herbs or medication can help. So all of that, but
Mhm.
definitely that's a big one that came to mind when you're
Yeah,
mentioning all
definitely,
that.
especially in the news now. So yes, that makes
Yeah.
sense. Yeah. All right. Mary is asking, can you speak on leaky gut? Is there a test for that?
So we're currently validating these tests, but we do know there's things we can test like zonulin, which is a protein that's found in the gut barrier. Elevated zonulin can indicate a more hyperpermeable gut barrier as well. You can test for secretory IgA, which is the immune system that lives in that mucosa, to see if it's very high, and that can tell you that mucosa is having kind of a response to something, an allergen or something. Or if it's very low, that can tell you that mucosa is quite thin. So we're working on validating these tests. They are out there, they are utilized. For so many years, people were getting food sensitivity tests, these IgG food sensitivity tests, and I call those an unofficial leaky gut test because IgG is your immune system in your blood. So if you, way back when, we all did, I did them like 10 years ago, right? We were all doing food sensitivity tests. But if anything showed up that really just means you have leaky gut, because if food proteins are and food, antigens are getting picked up in your bloodstream, they shouldn't be there. If your gut barrier is selectively permeable and really only letting important information and communication move back and forth and not necessarily food particles, nothing should show up on those IgG food sensitivity tests. I'm not telling you to do one, don't, they're a waste of money. But if you ever did one and you looked at the results and freaked out and said, everything I ate is on this test, you probably have intestinal hyperpermeability or leaky gut. And now more and more data is linking that also to autoimmune conditions. So we are seeing autoimmune diseases on the rise, and there are so many studies now coming out showing that leaky gut or intestinal permeability is part of that.
Thank you. This question is from Anthony, and he's asking, does having had a full colectomy change the way you treat chronic diarrhea?
Well, it depends on what type of support you're receiving afterwards. Did you have a partial? Do you have a total colectomy? Do you have an ileostomy? What is going on there? And how are your bowels performing? What amount of your small bowel is left? And how are your enzymes performing? How's your motility and your digestion? So everybody has a unique colectomy. Some have that ileocecal valve left intact, some have it removed. So that will kind of determine the symptoms that are associated with that colectomy and how that person needs to be supported.
Thank you. Okay, we'll take one last question here, and then we'll move into how you can qualify for the SIBO and IBS membership and some discounts. So this last question is from Scott. He's asking, are herbal antimicrobials an option instead of rifaximin?
I mean, short answer, yes, but it's highly individualized. You do want to see, okay, what exactly is going on? Which type of dysbiosis is it exactly? What are other maybe comorbidities? Because our average patient doesn't just have gut issues going on, they have other metabolic issues and blood sugar and pancreatic and so much more. And so that's where that context really comes into play and in handy. We do like both, and it's just, again, the right context. And like Dahlia mentioned, the good thing about pharmaceutical antibiotics at times is they can be very focused and specific and targeted. Herbals are not. And so you want to see which one's better for you. So,
And there was, I think a lot of people reference that study from Johns Hopkins that showed that,
yeah.
they could be just as effective as rifaximin. But again, like James said, that depends on what type of dysbiosis you're dealing with and how much you're dealing with as well. Because just as much as you don't want antibiotic course after antibiotic course, you do not want herbal course after herbal course. I have had instances where patients will kind of pulse. They'll take a course of rifaximin and neomycin and then herbs, and then 2 courses of rifaximin, neomycin, and then herbs. So it can be, like James said, highly, highly individualized. But like I mentioned, sometimes herbs make things worse. So that's where an integrative provider can give you that guidance, because we're studying it all. We're pulling from different modalities to fill your toolbox with as many plausible tools as we can.
Absolutely. Thank you. Thank you so much for that. I'm just going to hop the screen over to some of the Gemelli tests and walk through how you can enter. All right. So our Gemelli test that they mentioned earlier is the TrioSmart 3-gas breath test. It's the only at-home breath test that measures all 3 gases, methane, hydrogen, and hydrogen sulfide. And then we also have IBS-Smart, which is a capillary blood draw, like the picture that she showed earlier in this presentation. And that is a capillary blood draw for post-infectious IBS. So IBS that is caused from food poisoning. That is what that Tasso looks like, and that is the box for the TrioSmart test that it comes in. We're also offering $50 off of all of our Gemelli tests, including the malabsorption carbohydrate intolerance testing, and you can use check 50 for that code when you order it online through getgutanswers.com. And then this is the giveaway that Married to Health and James and Dahlia are offering. It's really incredible. This is the Good Gut SIBO and IBS program, and I just want to hand it over back to you and Dahlia, to James and Dahlia, just to explain what this actually is because it's really incredible. And while they're doing that, you can use your phone to take a picture of the QR code, and you'll be able to enter your information. And then with the thank you email that gets sent out later after this webinar, we will announce 2 winners. So would you like to explain a little bit further what this is?
Yeah, if you like anything that we said, it's there and more in the program.
Mhm.
So it is kind of a DIY. It's allowing you to really just dive deep into this. And don't let the plant-based kind of fool you. The goal here and one of the unique aspects of this program is we're all about using as many plants as possible. So that's a little bit or a lot of bit different than the normal SIBO IBS program, which is like eliminate, eliminate, and don't do these plants and eliminate those plants. Our goal here is to have a diversity of plants. And so you can do this if you're fully plant-based or just want to incorporate more plants. That is what this program is designed to do. And you can fully do it with the latest evidence on everything we said here and more. There's so much more context.
Mhm.
And so I don't know if you want to add
We
anything.
have so many experts in the course as well. We have an integrative gastroenterologist providing information on SIBO IBS. We have a pelvic floor physical therapist. We have our dietitian who does emotional release. We have an integrative and functional physician who's in there providing information. So we just took our collective brains and gave you as much information as we
And
possibly
another thing,
could.
as part of this, every month you join us for
Mhm.
a live cooking demo. So we do a Q&A and we're cooking one of the recipes for the program so you can see, and we usually eat it. We love our recipes. And we show you how to make a therapeutic recipe. And it gets into low histamine, low sulfur, low FODMAP, all, and it helps you navigate. So
And combinations of those
a
things for those who may
combinations,
need
yes.
them. Because again, we know just like treatment isn't one size fits all, neither is diet. So somebody might need a little combination of these things. So every month we're showing up, making a recipe, and answering your questions live in our live program.
That's incredible. Thank you. Well, I would like to win that. That's great.
Join us.
And right. And then oops, excuse me. And then I just wanted to this last screen is just a reminder of the check 50 for the Gemelli test, the Trio Smart test, the breath test, and the IBS-Smart blood test for post-infectious IBS. Again, you can bring your results right into Dahlia and James, and they can help you in your journey here to getting better and feeling better and empowering yourself to take care of your own gut health. um, Thank you so much, Dahlia and James. What a pleasure. This was really informative, incredible information. Thank you so, so much.
Thank
And thank
you.
you to everyone who joined us. The questions were amazing as usual. Thank you very much for spending your night with us. And I hope that you are all very well and have a great night. Thank you.
Thank
Thank
you.
you, everybody. Bye.
Bye.